All right, good morning, everyone. My name is Elizabeth Roldan. I'm the Director of Enrollment here for IMAC Insurance, and we're here to talk to you at the Township of Montclair about your 2024 open enrollment period. Open enrollment began this Tuesday, the 1st, and will be running through Thursday, October 31st. We'll say it a few times, but one of the most important takeaways is that this is a passive open enrollment. So if you're not making any plan changes, there is no action required on your behalf. But we strongly recommend that you at least log into Benefit Solver, which is the enrollment system for the state, to go ahead and just verify that everything is correct in there, especially if you have an address change or anything like that. And if you are looking to make any changes, everything has to be done through Benefit Solver as well. And we'll get into a couple more slides of how that portal, how to access that portal and what it looks like. So we are the broker for the township's health benefits. So we're here to talk about open enrollment, but throughout the year, if you have any questions about your benefits, if you have a claim matter that you need assistance with, we're certainly here to go ahead and help you with that and advocate on your behalf. You can contact our office by calling 973-450-9800, or you can send us an email to info@imacagency.com, and we will get back to you, usually same day. We're very big on making sure that we get back to people in real time, and we are very aware that things are time sensitive, especially if you're waiting on a pre-authorization or if you're having an issue getting a prescription drug. That's something that we pride ourselves in making sure that we are responsive in real time to members. So as I said, this open enrollment period began Tuesday, October 1st, and will be running through Thursday, October 31st. And that October 31st is a hard deadline. Please make sure that if you are going to be making any changes, that you submit them to the Benefit Solver system before then, because the state will not allow changes afterwards, unless you have a qualifying life event. But very important that you adhere to that October 31st deadline. And as I said, changes for enrollment are only processed through Benefit Solver. Benefit Solver also has an app called My Choice Mobile, and you can manage and view your benefits there as well. But as I said, you do not need to take any action if you are not making any changes, although you should review your information just to make sure that it is correct. This is what the Benefit Solver login page looks like. To access that page, you would go to mynjbenefitshub.nj.gov, and that is where you will go ahead and access your benefits to view them. And you would need to have an account created if you don't have one already. But you will enter in a username and a password. The system has a two-system verification where once you log in, for example, it will go ahead and send you a 6-digit code that will be texted to you. So just make sure that you have your cell phone with you when you're logging into Benefit Solver. And once you actually log in, this is kind of what your dashboard looks like. Across the top now, if you log in during open enrollment, you're going to be seeing a countdown there of how many days are left in open enrollment, and that's where you would be clicking if you are going to make any plan changes. But this is what your dashboard and your homepage in Benefit Solver looks like. This is what the My Choice mobile app looks like. Sophia is the virtual AI assistant that is in the My Choice app as well as Benefit Solver. But again, this is what the app looks like in either the Apple Store or the Google Play Store that you can download it and manage your benefits on the go as well. If you are making any changes as far as adding a dependent, such as a spouse or a dependent child, the state does require dependent verification. But again, this is only for people that are adding a spouse and or a dependent for the first time. If you've already done this, you do not need to supply this verification again. But the state does have certain requirements as far as the paperwork that they are requiring. So if you are adding on a spouse, they would need a copy of that marriage certificate and a joint tax return. If you are adding on a child, you would need that child's birth certificate as well. And if you have a stepchild or a foster child, there may be additional paperwork as listed here that you will need. But ultimately, again, this is only if you're adding on a dependent or a spouse for the first time. So for the 2024 open enrollment, there are plans that are offered under both Aetna and Horizon. This is a change that happened earlier in the spring. There was a special open enrollment period where Aetna is now offering the same benefits under their network in the state. So the plans that you had under Horizon are also being offered under Aetna. They have Aetna names. So for example, Aetna doesn't call their plans NJ Direct, they call them Freedom. So as you can see here, we put this little table together to show, what the equivalent plan in Aetna world is for, like for example, the New Jersey Direct 10 is called the Freedom 10 under Aetna and so forth. So the plan benefits are the same, the rates are the same. The only difference would be the network. So if there are certain doctors that may not participate with Horizon and they do participate with Aetna, that may be something that you may consider making a change in. But again, and I'll say this multiple times because this is a question that we get a lot, is there a difference in rates or benefits? And the answer is no. The only difference with the offerings is that one uses the Horizon network, the other uses the Aetna network. So that's really the only difference. You'll see that you have all of these plan options available to you when you log into Benefit Solver, and just make sure that you're choosing the right carrier that you want, whether you want a Horizon plan or an Aetna plan. We also have all the plans loaded on the IMAC benefits portal, and you can do a comparison between, let's say, Freedom 10 and Freedom 1525, even though it's the same plans that are in Horizon. But if you wanted to compare those two to see what the benefit differences are within the Aetna world, for example, you can certainly do that. But again, today for our purposes, we're going to be talking a little bit about the Direct 10 and Freedom 10 and how it compares to the Omnia and Liberty Plus, because those are two plan options that are comparable that we like to highlight during open enrollment because there is a cost savings by participating in the Omnia or Liberty Plus programs. So the Omnia plan and Liberty Plus, again, same benefits. Omnia is offered through Horizon. Liberty Plus is offered through Aetna. They utilize the same network of providers in both of those plans. So any provider that's in Direct 10 or Direct 15 is also in Omnia. And any provider that is in the Freedom 10 or Freedom 15 also participates in the Liberty Plus network. The Omnia plan, and I'll continue to just utilize Omnia because I know most of you are in the Horizon. Omnia does not have any out-of-network benefits, and that is something that we like to highlight because it is a cost savings option to the Direct 10. It does have different benefit differences, one of them being that it has no out-of-network benefits. So it's important to know that if you're somebody that does go out of network, this is not a plan option for you. But if you're somebody that likes to stay in network and would like to consider a lower cost option to save on your Chapter 78 contributions, the Omnia plan may be a good fit for you. The Omnia plan is a two-tiered network plan where it has a tier 1 and a tier 2. Tier 1 doctors, and again, it's the same network of doctors as in Direct 10. So what they do is they take the network and they split it, kind of like a 70-30 split, where 70% of the doctors that are in Direct 10, for example, are in tier 1, and that other 30% or so are in tier 2, but again, all in network. If you're going to a tier 1 primary care provider, it's a $5 copay in the Omnia plan, $20 for a tier 2 provider. And if you go to a specialist, your copays are $15 for a tier 1 provider and $30 for a tier 2 provider. Your emergency room copay is different under Omnia. It would be $100, but again, it's waived if you're admitted into the hospital. And just to showcase the differences a little bit more, as I said, same network across the board in Direct 10 as in Omnia. It's the Horizon Managed Care Network. In the Direct 10, you obviously have national network. Omnia only has in-network. So you do have national coverage, but you don't have out-of-network coverage, and that's a big highlight that I like to make. We discussed the copays, and all the plans in the state don't have out-of-network well visits. It's only in network. So again, that's important to note. But in the meantime, if as I'm going through this, please make sure that you submit through the chat if you have any questions about the plans as we're going through them. And just furthermore, just to go over the other high-level benefits that people are interested in learning more about, there is no deductible in network under Direct 10. Omnia, there's no deductible in Tier 1. There is a deductible in the out-of-network under Direct 10 or in Tier 2 under Omnia. But again, this Tier 2 deductible is for those Tier 2 providers and only for surgeries, hospital stays, but not pertaining to an office visit setting. So that's important to note. You're not subject to the Tier 2 deductible for an office visit setting. Your out-of-pocket maximum, which is the most that you would lay out in a calendar year, you do have differences there in the Direct 10 as well as in the Omnia. And it would be $400 for an individual under Direct 10, $1,000 for a family in network. The Omnia plan has a $2,500 out-of-pocket max in Tier 1 for an individual or $5,000 for a family. So again, some other differences to make note of. Neither of the plans require a referral, so there are no referrals required under any of these plans. Your labs are still the same. LabCorp and Quest are the in-network participating labs in the state. So there is no charge if you're going to a LabCorp or Quest office. Outpatient is covered the same way in network under Direct 10 as is in Tier 1 of the Omnia network. The out of network, again, you're subject to your deductible and coinsurance under Direct 10, and under Omnia, you'll be subject to, in Tier 2, your deductible and 20% coinsurance. And as I said, your emergency room copay does change going into the Omnia plan. So currently for those of you in Direct 10, that would be $75, but in the Omnia plan, it would be $100. So again, just we want to highlight some of these plan differences for those that are considering making a switch, because this is the time to do the research and to look into your plan options because you would be committing for the entirety of 2025 in whichever plan you choose, whether you stay in the plan that you currently have or if you switch to a new plan. And again, please feel free to submit your questions through the chat. I think I see one here. Question that I'm getting here is, how can one learn more about coverage levels, tiers, when in Omnia and traveling out of the state or out of the country, or if a covered dependent is away at college, etc. We do have a slide coming up about how to do the search on Horizon's and also on Aetna's websites. But basically, in Horizon World, for example, when you go to horizonblue.com, and I'll skip through a couple of slides and I'll come back to them, but just to showcase this question now. When you go to horizonblue.com and you do a search for a plan, you would either, for example, do the search for NJ Direct or for Omnia. When you're looking up Omnia providers, it'll tell you in the Horizon website whether it's a Tier 1 or a Tier 2 provider. Again, anybody who's in network now under Direct 10 is in either Tier 1 or Tier 2 of Omnia because they utilize the same network of providers. So it's important to note that. But to see if they fall under Tier 1 or Tier 2, that's where you would do the search on horizonblue.com's website or Aetna's site. And to just touch upon that question of anything out of state, if you have, for example, a dependent child that is going to school outside of the state, you would it would automatically be a Tier 2. Anything outside of New Jersey is a Tier 2 provider. So for example, if you're going into New York City for treatment at Sloan Kettering Hospital for Special Surgery, Columbia Press, even though they are in network, they would be a Tier 2 provider because they're out of the state of New Jersey. So I hope I answered that, but again, feel free to keep those questions coming through the chat. And as always, if you think of anything after the presentation, feel free to reach out to us directly. We love talking to employees one-on-one and just having them have a better understanding of how any of the plans that are being offered, because it's quite a few options, which one would work best for them and their family.
How are you?
And I'm sorry, I'm getting some feedback. We're recording the webinar. If you could place your mic on mute, that'd be great. Thank you. So just to talk about prescription highlights, for those of you that are in either the police, fire, or library, Your prescription benefits are what's called MMRX, which you pay 10% under Direct 10 for your prescription, 15% under Direct 15. And for if you're in 1525 or in 2030, you're paying 20%. But again, you pay, for those of you in police, fire, and library, you're paying a percentage of the prescription. For those of you that are in the civilian population, you have a copay that you pay for your prescriptions. And we have both of those highlighted in the portal. But again, for those of you in the civilian population, this graphic here is specific to you, so you know under any of the plans what your prescription copays would be. One of the questions that we get a lot is, how do I do a search if if I'm prescribed a new drug to see how it would be covered? Your coverage is through OptumRx, and OptumRx's website is fantastic. You can do a search on there to see not only if your drug is covered, but also to search in your zip code to see what local pharmacies, what they charge for that medication. Whether it's at Costco, Walgreens, or an independent pharmacy shop, the prices can certainly vary on prescription drugs. So it's important that you do your due diligence to make sure that you're saving the most when you're getting a new prescription. So you can certainly do that search on OptumRx's website. We have that link for the website as well on the IMAC benefits portal, as well as it's on Benefit Solver. But they have a great search engine to do searches for coverages as well as drug pricing in your zip code. So next steps, as I said, if you're not making any changes, you do not need to go ahead and take any action, but we do encourage you, however, to go ahead and review your information on Benefit Solver. If you are making a change to your dental, that is not on Benefit Solver, that is on a direct basis with the carrier. And there are enrollment and change forms on the portal as well for you to make those changes if you need to with dental. But if you are making any changes or waiving your coverage, you do have to complete that on Benefit Solver, as well as any enrollment forms if you're making that for dental. But for medical and prescription, you would be waiving or making changes to those coverages directly on Benefit Solver. As I said, we have the IMAC portal updated and available to evaluate your plan information and contribution information. I said this at the top of the meeting, but I'll repeat it because I know that we have some people that joined not that long ago. The state has not finalized its contribution calculator. It will be finalizing it, from what I've been told, within the next week. So we're waiting on those links to be provided from the state, and we can go ahead and share that with the township as soon as they're made available, and also post them on the portal. And just as a reminder, you are making a plan selection for the entirety of the 2025 year. You'll be eligible to switch plans again during next open enrollment, which would be October of 2025. And again, the most important takeaway for today is that you make sure that you understand that the deadline for open enrollment is October 31st. This is imposed by the state, not the township. They will not allow for changes to be made after that deadline passes. So it's very important that you make sure that you make your changes ahead of time. You literally have until midnight on October 31st. Would I suggest waiting until then? Absolutely not. We've had issues with members over the years that they've waited last minute to go ahead and make their changes. And for whatever reason, they've had issues trying to log into Benefit Solver. And we actually had a member last year that they waited until the very last day. They had to reach out to tech support at Benefit Solver to make their changes. They weren't able to get in touch in time because the call volume to Benefit Solver was so high on the last day of open enrollment last year, and they actually were not able to make their changes. So it has happened. We know that from personal experience with people. So please make sure that you can log into Benefit Solver. And if you can't log in and you have an issue, to reach out to the team at Benefit Solver to go ahead and get your credentials reset, so you can log in and see your benefits and make any changes that you'd like. Once again, the IMAC benefits portal has everything and anything related to your benefits right now. Everything that we've been covering here, including a copy of this presentation and a link for the recording of the presentation, is going to be posted on the benefits portal. But right now you can view rate information, you can review plan information, you can compare plans. So I highly encourage you to bookmark this in your browser. It's imacbenefits.com. The guest key is Montclair Township with a capital M, no space, and a capital T. But again, we update the portal very frequently with anything new that comes out related to your benefits. We do a monthly newsletter on there. We have a ton of health links as well. So please take advantage of that. And information about NJ Well, which I know we have a slide coming up about that, but it's a great wellness program that the state offers its members that if you haven't participated in it, definitely something to look into. Something else that we like to highlight during open enrollment is life events. So while this is your open enrollment period, every year as it is in the month of October, we understand that life happens outside of open enrollment. So if you do have a change such as you're getting married or you have a newborn child or you get a divorce or God forbid a death in the family, you do have 60 days to complete that enrollment and or change with the applicable documentation on Benefit Solver's website. So if you have a baby on September 1st, you technically have until October 31st to add that baby onto your benefits. And if you miss that 60-day window, you will have to wait until the following open enrollment in order to add on that dependent, for example. For those of you that terminate coverage because you're gaining it elsewhere, such as with your spouse, that is a 30-day limit. So something we like to highlight during open enrollment. Coverage, whether you're making it for a change because you're adding on a dependent and or a spouse, or if you're terminating coverage because you're gaining it elsewhere, it's retroactive to the date of the event. So going back to the example of if you have a baby September 1st, but you don't get a chance to go ahead and add the baby on until, let's say, October 15th, you will have the coverage retroactively put back to September 1st, which is the date of birth for that newborn dependent. But again, if you have any questions about life events and what the required documentation is, definitely feel free to reach out to us. We can walk you through it. But annually, your open enrollment period takes effect in October. And it happens in October for an effective January 1st date. I apologize for that. And during open enrollment, you can make the following changes, such as adding or removing dependents, changing in between plans, waiving coverage, or enrolling in coverage if you've previously waived. Something else that we like to talk about during open enrollment is what happens to those dependent children that age out at the end of the year. So if you have dependent children, the year that they turn 26, they will be automatically removed from your benefits. The state does that automatically. And they have until the end of the calendar year in which they turn 26, and that's when their coverage is going to be removed. They will be offered COBRA, and that's an automatic thing that will be issued by the state. If they meet certain criteria, they may be eligible for a New Jersey state mandate called Chapter 375, which we will get into in the next slide. And if your child is overaged and has special needs or is a disabled dependent, there is coverage continuation for those dependents as they age out. There's an entire form that would need to be completed not only by you as the dependent's parent, but also by the dependent's provider. And we can certainly walk you through that process. But we do have a link about that as well on the IMAC benefits portal and on Benefit Solver. So Chapter 375 is a New Jersey state mandate that certain children, if they meet certain criteria, once they age out at the age of 26, they may be eligible to stay on the same plan that you're on for medical and for prescription under this mandate. They have to be unmarried, have no dependents of their own, live in the state of New Jersey or be a full-time student outside of the state of New Jersey, and that they are not eligible for Medicare or covered under any group plan, any other group plan, I should say. If they meet that criteria, they would be eligible to, again, go on a plan, go on the exact same plan that you're on now. The reason that we mention this is because it is a much lesser expensive option than COBRA. Chapter 375, and we have those rates for 2025 posted on the IMAC benefits portal right now. Those rates are 60.8% of the single rate for the plan that you're in versus COBRA, which is 102%. of the plan that you're in. So very important that you realize that Chapter 375 is an option for those dependents that age out, and that it is more cost effective than COBRA. But again, they have to meet this criteria. There is an entire application that is completed for this, and the state would be billing you and your dependent child directly. So the contributions for that plan would not be coming from your payroll. It would be billed directly from the state to you and your dependent child. But again, feel free to reach out if you have any questions about this program. As we said before, you can do a search for providers under the Horizon website. If you go to horizonblue.com/doctor finder, we also have this link on the IMAC benefits portal that you can do a search for providers as well. So if you are thinking of switching in between any of the Horizon plans, some of them do use different networks, so it's important that you understand that. But like I said, Direct 10 and Omnia, same network of providers. It's just a matter of whether they fall into Tier 1 or Tier 2. Same thing under Aetna. Aetna also, as we said, offers the same exact benefits that are offered under Horizon. You can also do a search on their website for any of the plans that are being offered, and that would be at aetnastatenj.com. And this is a little bit of a screenshot of what it looks like once you log in there. You don't have to log in as a member. You would continue as a guest and search for a provider within your zip code, and you can narrow your search down for any type of hospital or specialist or any type of provider that you're looking for specifically. Horizon B-Fit is a gym reimbursement program that happens in the state of New Jersey. I know that Aetna also offers it as well. They don't have any information posted about it, so I couldn't share that. But Horizon B-Fit, if you go to the gym 12 days or more during the month, or now if you do 10,000 steps a day, you are eligible for a $20 reimbursement on a monthly basis, up to $240 a year. If you'd like more information about that, I would highly encourage you to visit horizonbfit.com, and you can enroll. They'll verify that you're eligible. They're going to ask you for your member ID, and you will then continue on to be enrolled, and then it'll automatically get paid to you as a direct deposit on a monthly basis, so long as you go to the gym 12 days or more, or that you do your 10,000 steps, and it's all managed through the Horizon B-Fit app. So just a nice enhancement that the state offers. Same thing under Horizon. They offer a lot of great discounts under what's called Horizon Blue 365. It's a discount program, so if you go to blue365deals.com, you can sign up to receive weekly emails of savings towards LASIK eye surgery, meal delivery services, even certain gyms that you'd like to join. They offer discounts for Skechers sneakers. There's a ton of great discounts as Horizon members that by going to blue365deals.com, you can sign up to receive those emails. Also, Horizon as well as Aetna, they have an app, so you can manage your benefits on the go. And for Horizon, it would be the Horizon Blue website, and you can download the mobile app from there. What I like about having the mobile app, whether it's for Horizon or for Aetna, is that you can have a digital copy of your ID card with you. So if you ever forget your ID card at home, you can always pull it up via the app. And the last thing that I wanted to discuss is NJ Well. NJ Well is a health benefit program that incentivizes members to go ahead and get your physical, dental checkups, and any other preventative services that you may be getting during the year. And you work towards accruing points to earn a $250 gift card, not only for yourself, but if you have an enrolled spouse on your plan. The program runs every November 1st through October 31st. So some of you may be at the tail end of accruing your points, or if you wanted to get started fresh, start on November 1st with accruing your points. You would go to nj.gov/njwell. I'm sure a lot of you are already doing most of these activities, such as going for a vision checkup, women going for their gynecological checkup, and so forth. So make sure that you participate in this, because you can earn a $250 gift card for yourself and an additional one if your spouse completes their activities as well, their wellness activities. With that said, that really is the end of our presentation. Braden, I don't know if there's anything else that you'd like to add. I don't see any other questions in the chat, but again, I would highly encourage you to definitely review all the plan offerings on either Benefit Solver or the IMAC benefits portal. And feel free to reach out to us via, calling our office or sending us an email, and we can certainly talk to you about how, what plan works best in your situation. Braden, go ahead. I'm sorry.
You've been very helpful. Thank you. I don't have anything to add. You've been great. Thanks, Liz.
Perfect. Anytime. That's what we're here for. So with that said, I will conclude the presentation. We will be posting this on the portal at some point today, the slides and the link for the recording. And again, feel free to reach out and make sure one big takeaway, October 31st, that is the deadline for open enrollment. Thank you so much for your time today, everyone. Have a great rest of your day.
Thank you. Bye.
Thank you. Bye-bye.